Hello, and welcome. You ever stop and wonder how a simple thought, like, I want to grab that coffee, turns into the incredibly complex action of actually reaching out and picking it up? Well, today, we're taking a journey into your arm's hidden control panel, that amazing superhighway of nerves that makes it all happen, the brachial plexus. Okay, at first glance, this might look like a totally chaotic mess of wires, right? But I want you to think of it more like the electrical grid for your entire arm. It is a beautifully organized highway system. And this diagram right here, this is going to be our map for the whole trip, all the way from your neck down to your fingertips. So what are we actually looking at? Officially, the brachial plexus is a network of nerves. It all starts with 5 specific spinal nerve roots. We call them C5 through T1. And here's the kicker. This one network is the single source for basically all the muscle control and all the feeling in your arm, your forearm, and your hand. It's the whole show. So here's our game plan. We're going to start by building this 5-part superhighway from the ground up. Then, we'll see how those highways turn into specific commands for your muscles. And finally, we'll take a look at what happens when, well, those signals get interrupted. All right, first up, let's build this thing. See, the brachial plexus isn't just one single nerve. It's this incredible structure that merges and divides in a very specific 5-part sequence. We're going to follow that sequence, starting right where the nerves pop out of the spine in your neck. Here they are, the 5 key components, and they always go in this order. It starts with the roots, which then merge into trunks. The trunks split into divisions, which then recombine to form cords. And finally, those cords send out the terminal branches that go out and do all the actual work. See? It's a really logical flow. Now, how on earth are you supposed to remember that order? Well, luckily with one of the most famous mnemonics in all of anatomy. Just remember this phrase: Randy Travis drinks cold beer. Roots, trunks, divisions, cords, branches. Trust me, it's a lifesaver. Okay, let's jump back to our map and see how this all comes together. It all begins right here with the roots. These are basically the starting points of 5 spinal nerves: C5, C6, C7, C8, and T1. This is ground zero, the power station for our entire grid. And what's so cool is that the plexus starts sending out important commands almost immediately. I mean, right out of the gate. From the roots themselves, you get branches like the dorsal scapular nerve, which controls the muscles that pull your shoulder blades back, and the long thoracic nerve, which is crucial for holding your shoulder blade flat against your ribs. And this is where it gets real. It's the perfect link between the anatomy and what it actually does. If you damage that long thoracic nerve, the muscle it controls gets paralyzed, and the shoulder blade literally can't stay flat anymore. It sticks out, creating this condition people call a winged scapula. Okay, on to the next step, the trunks. This part's pretty straightforward. The 5 roots merge down into just 3 main highways. The top 2 roots, C5 and C6, join up to form the upper trunk. The middle one, C7, just keeps going all by itself. And the bottom 2, C8 and T1, join to form the lower trunk. And just like that, 5 roads have become 3. Now for a really crucial step. Each of those 3 trunks splits in 2, which gives us 6 total divisions. And this is where the design is just genius. You get 3 anterior divisions and 3 posterior divisions. All the anterior ones are going to go on to supply your flexor muscles, the ones that bend your elbow, like your biceps, and all the posterior ones supply the extensors, the ones that straighten it, like your triceps. It's a perfectly clean functional split. All right, we've covered Randy for roots, Travis for trunks, and drinks for divisions. Now it's time for cold, the cords. Those 6 divisions we just made are now going to recombine in a very specific way to form 3 main cables that will carry the signals deeper into your arm. So looking back at our map, we can see these 3 cords: the lateral, the medial, and the posterior. Now here's a pro tip. Their names have nothing to do with where they came from. It's all about where they are. They are simply named for their position around the axillary artery, which is the major blood vessel that runs right through your armpit. So how do they form? This table lays it all out pretty clearly. The 2 anterior divisions from the top come together to make the lateral cord. That last anterior division from the bottom continues on as the medial cord. And then, beautifully, all 3 of the posterior divisions, remember, those are the ones for the extensor muscles, they all unite to form one single, big posterior cord. From these cords, we finally get to our major branches. Let's just take the posterior cord as an example. It gives off some nerves to key shoulder and back muscles, but its main outputs are 2 absolute superstars: the axillary nerve,
which powers that big deltoid muscle on your shoulder, and the massive radial nerve, which controls pretty much every single extensor muscle in your arm and forearm.
So if Randy Travis helped us remember the overall structure, here's one more little mnemonic to help us remember the 5 major terminal branches, the true end-of-the-line nerves. Just remember MARU. That stands for musculocutaneous, axillary, radial, median, and ulnar. These 5 are the final commands.
So we've built this incredible network from start to finish. It's amazing, but its complexity also makes it a little bit vulnerable. So in our final section, let's talk about what happens when this intricate wiring gets damaged.
An injury anywhere along this path, anywhere from the roots all the way down to the final branches, can have really specific and pretty dramatic consequences for how your arm works. Let's take a look at some of the most classic examples.
Okay, let's look at the 2 big ones. An injury to the upper trunk, which affects the C5 and C6 nerve roots, is called Erb's palsy. This can happen during a difficult birth or from a bad fall, and it results in a very distinct posture known as the waiter's tip position. On the flip side, an injury to the lower trunk, affecting C8 and T1, is called Klumpke's palsy. This can happen if your arm is suddenly yanked upwards, and it paralyzes the small muscles in the hand, which leads to a claw hand.
And there are plenty of others. If you fracture your shoulder, you can damage that axillary nerve we talked about, making it impossible to lift your arm out to the side. If you break your main arm bone, the humerus, you can injure the radial nerve, causing what's called wrist drop, where you just can't lift your wrist up. And, as we already saw, damage to that long thoracic nerve leads to the winged scapula. So as we wrap this up, it's just amazing to think about how this system is working, non-stop, completely behind the scenes. From something as simple as a shrug to a powerful throw, every single movement your arm makes starts as a perfectly timed electrical signal zipping down this complex and really elegant highway. Seriously, every single time you type or wave or lift something, you are firing up this incredible network. It truly is the control panel for your arm. And it kind of makes you wonder, what other complex, perfectly designed systems just like this are hiding in plain sight inside our own bodies, just waiting for us to explore them? Thanks for watching.